Hey guys, this is Dr. Allen from Ried Physical Therapy, and I have a question for you. Why does the front of my hip hurt? I asked this question because currently I am having a little bit of anterior hip pain, and I figure if I am, then other people may be too. So obviously I can't tell you exactly what's wrong with you without having you come in to the clinic for a full assessment, but there are a few of the most common causes that can be contributing to pain in the front of your hip, and I thought I'd share them with you. So the first thing to realize is you have a few muscles in the front of your hip. They connect from your pelvis, run downwards, cross the hip joint, and connect to your thigh bone. And vice versa, they run up from your thigh, cross the hip, and connect to the inside of your pelvis. And so if you had a strain of those muscles, maybe from a sports injury, some sort of athletic injury, or you were hit in the area, something like that, those muscles can be inflamed. Maybe there's a pull, a strain, something like that. So that's the first cause, is just an injury to the muscles in the area. Another thing I see quite often is called impingement, and that is when the ball and socket of your hip joint looks kind of like this. Whenever you bend your hip forward and the ball is forced to rotate anteriorly, if there's some tightness in there, some weakness, something's not moving well in that hip joint, you will get some pinching in the front of your joint, and that's often how it's described. And so if there's any sort of impingement, maybe some labral impingement, something like that, in the front side of your labrum, you're gonna have pain on the front side of your hip. Another thing to consider, we can't forget, is that we have a lot of nerves that start in our low back, and a few of them, once they exit your lumbar spine, travel down towards your legs and through the front side of your hip there. And so another thing that a physical therapist should always check for is this nerve pain, right? Is there an impingement of this nerve somewhere that can be contributing to this? So those are some of the most common causes that I see when pain is located specifically in the front of the hip. Like I said, I can't diagnose you without actually seeing you. These are just some of the things we see most often. But if you are having pain that's constant, or at least has been bothering you for a while, then it would be a good idea to have it checked out by a physical therapist or a healthcare professional.